Hi, my name's Anita, Case Manager at Dental Protection. Welcome to RiskBites, a series of podcasts created specifically for dental practitioners in Australia. RiskBites looks at the key dentolegal risks and issues affecting dental practitioners across Australia and provides helpful advice and guidance on how to steer clear of them, leaving you free to provide safe and high-quality dental care for your patients. In this edition, I'm joined by my colleague, Dentolegal consultant Dr Annalene Weston, and we're talking about the second victim and the second arrow. So Annalene, where shall we begin?
Well, Anita, I recently stumbled across the parable of the second arrow. Now, this is a sutta of Buddha, and I'll confess, I was quite shocked not to have heard this teaching before, because it essentially shines a light on everything that we at Dental Protection strive to impart to the second victim in any complaint or adverse outcome.
So before we delve into the second arrow, Annalene, I think our listeners are going to be curious to know what or who is the second victim.
Yeah, I think so too, Anita. And simply put, it's usually us, the clinician. So imagine you're treating a patient appropriately to the best of your ability and with all good intent. But regretfully, during that treatment, something goes wrong and the patient's harmed.
We've all been there, and I think the first thing we need to unpack is why or how this happens.
Yeah, I agree. And likely it's just bad luck, because remember that sometimes in the practice of dentistry, as in all aspects of life, things just don't go to plan. So the patient's the first victim, right? The injured and the harmed. And naturally, we have an obligation to help that person return back to the position they were before this harm occurred.
This is one thread of duty of care, isn't it, Annalene? That non-delegible and intrinsic obligation that was settled on our shoulders in many ways before we took the Hippocratic Oath.
It is, and it's a critically important aspect of being a professional, and one we'll explore more fully on another podcast. But that's the patient. So what about us then, the treating clinician and the person whose hands were in the mouth at the time that something went wrong? Where do we sit in this? Because, it's reasonable to assume that the overwhelming majority of us are neither sociopaths or psychopaths. So consequently, we all have a well-evolved social conscience.
So why is this reasonable to assume?
Well, generally, Anita, it's because sociopaths and psychopaths are not drawn to house care, as tending to the needs of others above their own day in and day out is simply not going to be a good fit for those personality types.
Well, that's a fair point and also really reassuring.
Indeed. So now back to why this is important. It's because we put the care in healthcare, approaching every day with the noble intent to heal and not harm. So occasions then where we cause unintended harm can weigh upon us heavily.
Would we ever cause intended harm?
Yeah, we would. I think administering chemotherapy is probably the most cited example of causing harm to heal. But you also need to consider our core trade, which is essentially amputation medicine.
What are we amputating?
Diseased tissue. So whether this is removal of caries for a filling or extracting an entire tooth, while it's intended for the greater good and to support a return to health, do we as clinicians really not think that extracting a tooth is harmful? Consider without consent, it would constitute battery. And when all's said and done, it is a significant procedure for the patient. And in fact, a procedure of this magnitude undertaken to another body part would likely require hospitalization. So back to the causing of intended harm and using extraction as an example. If you were extracting an upper six and you pushed the root into a sinus, which required remedial treatment under general anaesthetic for the patient, and this is going to be accompanied by many days of work for them, how's that going to make you feel?
Pretty horrible, I expect. And certainly this is what our members tell us. They feel pretty horrible right up until that point where the patient is fixed and often beyond.
Yep, and that pervasive, awful feeling, which will be the first thing you think about in the morning and the last thing that you think about at night, exemplifies the plight of the second victim. Yes, the patient suffers harm, absolutely, and I'm not in any way diminishing that. But it must be recognised, Anita, that we, the practitioner, the person responsible for that harm, we suffer as well. Now, this inconvenient fact is often overlooked by patients and their advocates because it doesn't suit their narrative. They want to see us as almost being like a bully, right? But however convenient to the truth of others acknowledging this might be, the truth of the matter is that we, the clinician, do suffer along with them.
So that explains the second victim, and I absolutely agree with this concept, Annalene, as I see this experienced by many of our colleagues and our members day in and day out. Where does Buddha's arrow come in?
Well, I'm glad you asked, Anita. So, have you ever noticed that in every contemporary patient complaint, there's always the reference to my pain and suffering, which patients clump together as one compensable item?
Yes, I have. And of course, Annalene, as we both know, this is often not the compensable item that patients perceive it to be, as there are standards and a threshold around the calculation and granting of compensation.
Yeah, absolutely. And interestingly, while the compensation legislation often clumps pain and suffering together as this neat little package, Buddha does not. In his teachings, Buddha sees the two items as two separate events, two arrows, if you will, with the first arrow causing the pain and the second arrow representing the suffering.
Go on.
So the first arrow to strike is the first event and causes the pain. And just like something going wrong in practice, you can't control it. It just happens. And it can be as out of the blue as being shot in the dark. But what you can control is the second arrow, which essentially is the arrow that we fire at ourselves and our reaction to the painful event.
I think I can see where you're going with this, Annalene, and why you believe this is so relevant.
Yeah, because we cannot control the first arrow, right? If we could have controlled it, we would never have let it happen. But what we can control is our response to the events that have unfolded. Interestingly, Anita, the second arrow, our response, is often the arrow that causes us the most harm.
People often catastrophize this when there has been an issue or a complaint, don't they, Annalene? Is this an example of the second arrow?
Yeah, it is. When something goes wrong, it's really easy to fall into unhealthy patterns of thinking. So, catastrophizing, right? Believing that the end is nigh. I'm going to lose my registration. Everyone's going to find out. Everyone's going to know what a terrible clinician and a terrible person I am, and so on.
This doesn't sound dissimilar to the voice inside our head during imposter syndrome, Annalene.
I would agree. And it's a strand of the same narrative, Anita. Many of us are so wedded to the idea of being a good clinician that any challenge to this can really wobble our self concept, leading us to blame ourselves, self flagellate, and feed our inherent feelings of low self worth. It's important that we do keep some perspective when things go wrong in our clinical practice, hard as this may be. It can really help to remember your intention. And by this, I mean that you didn't get up in the morning intending to cause harm to a patient. Quite the opposite. You were intending on helping, and for whatever reason, things just didn't go to plan on that day.
It can help to talk to someone as well, like someone like a peer or a professional.
Absolutely. And while it often helps if the person you're talking to meaningfully understands the circumstances, so a colleague, for example, please never devalue the importance of talking to a friend or family member. There's no shame in having a bad day, so don't be embarrassed to talk about it. While we can't control this first arrow, we can definitely control the second by choosing our response to the initial event. It goes without saying, I think, Anita, that we need to be kind to ourselves. And I can't help but wonder if many of us are holding ourselves to an unattainable standard. And then we quickly slip into this negative and unkind internal narrative when we don't live up to our own expectations.
I mean, we really are only human after all.
We are. And when reading around this sutta from Buddha, I noted the suggestion that rather than let the second arrow hit, we instead send the second arrow straight into the ground. And I quite like the imagery of that.
Maybe we should all give this a try.
Yeah, let's do that.
Well, thank you, Annalene, and thank you for listening. And we do hope that this podcast was helpful to you and look forward to sharing more guidance with you in the future. If you like Dental Protection's podcast and would like to hear more, please subscribe and leave a review.